the first lecture, Platelet-Rich Plasma or PRP in the treatment of knee osteoarthritis is delivered by Dr. Swarnakumar. Dr. Swarnakumar is the Senior Consultant Orthopedic Surgeon at the National Hospital of Sri Lanka, which is the main government hospital providing free health services to the nation. He obtained his medical degree from the University of Jaffna and his master's in surgery from the Postgraduate Institute of Medicine, Colombo, Sri Lanka. He is a fellow of the Royal College of Surgeons, Edinburgh, Scotland. Now please welcome Dr. Swarnakumar, Senior Consultant Orthopedic Surgeon.
Good evening, everybody. Hope you can hear me. First, I would like to thank Physiotherapist organization in Sri Lanka for inviting me and sharing my experience in orthopedics practice of usage of platelet-rich PRP. And as our Director of Health Services addressed, osteoarthritis is a common problem worldwide, and we have to spend a lot of money in managing these patients with osteoarthritis worldwide. In Sri Lanka, we have been managing with non-operative management, and it is partly done by the physiotherapists. They play a major role in managing them before considering any surgical management, or even after surgical management. You all have a main role, and you have been one of the pillars in supporting orthopedic surgeons, not only in Sri Lanka, worldwide. So again, I would convey my message to all for successful international meeting this time. And again, I would like to thank you for inviting me in this great occasion. The platelet-rich PRP in orthopedic practice, just I would say, and again, I will focus mainly in the management of osteoarthritis. So, what is PRP? Everyone, you know that platelets, they have a great number in the blood, 150,000 to 450,000, and they have the diameter of 2 to 4 micrometer in diameter, and they have a 7 days of half-life, and they are alpha and dense granules, and they contains so much of growth factors. Because of that, we have selected the platelet for the treatment of healing wounds as well as in the management of osteoarthritis. So what is PRP? This is the autologous blood taken from the patient, and it has the count and the significant count, as I told before. And in the PRP, that is after centrifuging and getting the number, it gives 5 times the normal count of platelet in the concentrate. Platelet-rich plasma is injected, and it is popular worldwide, and also it is used in variety of conditions, sports injury to hair loss. The treatment and the platelets with the growth factors concentrated in it, it has the healing effect. Therefore, PRP has a major role nowadays in the management of many conditions. So main functions of the platelets, if we can consider it as hemostasis. As you all know, this has the first role in the management of bleeding. So it forms a platelet plug. It helps in blood clot formation. And there are so many secretions, including growth factors. It promotes cellular chemotaxis and proliferation and differentiation of cells. And it also helps in proliferation of human adults, MAC, that's a PDGF. Proliferation of fibroblasts. Fibroblasts, you all know it is important in the wound healing and also in inflammation, part of the inflammation. And angiogenesis, that means it helps to revascularization of the tissue when there is damaged. Regeneration of appropriate tissue. That's why we use in wound healing, and also in practice we use in fraction on union also, because it helps to regenerate the tissue. So biomaterials should follow when we select this PRP. Why it is selected? Because it should enhance tissue repair to a clinically significant degree. It should not lead to a scar formation. When we are giving something, if it causes scar formation, then it is not recommended. So it provide minimal risk to the patient. It should act only locally, but not systemically. It has to be cost effective, especially in our setup like Sri Lanka. It has to be easy to apply. So that's a property of a material when we select for you. When we talk about actions of PRP, it accelerates endothelial, epithelial, and epidermal regeneration. It stimulates angiogenesis, enhances collagen formation, promotes soft tissue healing. Therefore, it helps in wound healing as well as repair of tissue after surgery. So it has a major role in post-operative patients. Enhances hemostatic response to the injury and reverse inhibition of wound healing caused by glucocorticoids. As you all know, when we give glucocorticoids, it reduces the wound healing, but with PRP, it reverses the action of glucocorticoids. So why PRP is selected? It has so many growth factors it contains. So these growth factors are released when the platelet is injected. So for example, FGF, that's a fibroblast growth factor. It helps in tissue repair. Epidermal growth factor, it helps in epithelial cell growth and also angiogenesis. Keratinocyte growth factor, it helps in degeneration of keratinocytes. TGFB, that's a transforming growth factor. It helps for endothelial transformation. VEGF, vascular endothelial growth factor. So it helps in vascular endothelial cell regeneration. PDGF, that's a platelet-derived growth factor. So it helps for cell growth, new generation, and repair of blood vessels. So many factors are there in the normal count, and also when it is concentrated, it gives better effect because of these growth factors. So considering all these factors from the platelets, that's the growth factors, inflammatory mediators, and it contains fibrinogen. Fibrinogen, it acts as a scaffolding effect and anti-inflammatory effect from the inflammatory mediators, and also growth factors, it has anabolic effect. So considering all these three factors, the properties of these platelets we are using in platelet-rich plasma. So when you take this platelet-rich plasma, there's a PRP, there are two types when we after concentrate concentrating this one. It contains leukocyte poor plasma, that is LP. It is used in osteoarthritis, acute muscle injury, and also in tendon repair. But leukocyte-rich plasma, it is well used in tendinopathies. So when we use this platelet plasma, I will tell how it is prepared in the next slide. So there's a classification we use for platelet concentration that's compared to baseline concentration in the whole blood. It is high, and activation method, that's endogenous, exogenous methods. It contains thrombin, collagen, and calcium, and white blood cells are used. So all three are used for classification of this PRP. So how do we prepare this PRP? Usually we draw about 3 to 60 ml of blood from patients, and it is centrifuged for 15 minutes at the rate. Once we centrifuge this blood, the picture shows the red blood cells, it sediments at the bottom, next white cells, and above the white cells we can see the platelets, and on top of that, the plasma. So the plasma in the upper part, it contains less platelets, but the plasma layer next to white blood cells, it contains concentrated platelets. So that part only we use for treatment using this PRP. So we take about 3 to 6 ml of PRP. It is 4 to 10 times concentrated than the normal platelet count. Sodium bicarbonate used to neutralize the activity of this sample. So after using this is used. So this is the way the blood is taken from the patient, and it is centrifuged. After centrifuging, we can see the platelet-rich plasma. There's a PRP fraction 1 that's in the top layer. It contains less platelets. That's what is called PPP. That is platelet poor plasma. And fraction 2, that is the layer just above the white cell count, is called PRP. There is a platelet-rich plasma. So that upper part of this plasma is removed, and the plasma above the layer of white cells, it is taken and injected to the region for the better outcome of these patients. So factors affecting action of PRP on tissue healing, because PRP has to work on the tissue healing, and there should be the favorable environment for the platelet to activate. There are endogenous and exogenous activations are there. When the platelet concentration is 1 to 5 times fold, it has more action than when it is more than 10 times folds. That's why we take only 50 to 60 ml of blood to take the appropriate concentration of the plasma. And volume of PRP. So when we give, it has to contain reasonable volume of PRP. So then the activation will be better. And it has to contain relative concentration of WBC. That's what I told you for the healing of the wound or tendinopathies. The platelet containing WBC has a better role in the management. So what are the orthopedic applications of PRP? Mainly for non-surgical conditions, non-surgically managed conditions, medial and lateral epicondylitis, plantar fasciitis, Patella tendinopathy, and osteoarthritis of knee. Surgical interventions after Achilles tendon repair or any other tendon repairs, mainly rotator cuff repair. After ACL reconstruction, when we use PRP, it gives better outcome in the management of incorporation of the graft with the bone, and also it promotes healing of the repair. It has advantages because it's an autologous product. We take from the same patient and we separate the autologous. So it is done as an outpatient procedure. We don't want to admit the patient. They come and do the procedure and can go home. There are very minimal complications, less chance of infection. We use it under sterile condition, and there's less rejection because it's a own patient's product. There's an autologous product, so there's less chance of rejection, and there are no systemic effects, and it's readily available. We don't want to prepare additionally. The patient, when he comes, we take the blood and prepare it and inject. Less long-term complications. Long-term complications are not reported commonly. Clinical examples, when we take partial tear of supraspinatus tendon, we use supraspinatus tendon. It is a deeper structure, not like epicondylitis. It is a bit deeper. And if we can use ultrasound, that's ultrasound guided injection, then we can inject to the area there. And even other places like the picture shows there's a injection of the elbow for lateral epicondylitis. So the same way, when we use the ultrasound guidance, we can exactly localize the place where we have to inject it, and we can inject. Platelet acts as a scaffolding for mesenchymal stem cells, which starts the process of tissue regeneration. So it is a better scaffolding effect when we are using. After injection, it has no discomfort, but some patients, they have minimal discomfort for about a week. They may have the pain at the local site after the injection. Because anti-inflammatory drugs, they have the antiplatelet function. For example, aspirin and other NSAIDs, they are used in patients with to delay blood clotting. So if we can avoid usage of anti-inflammatory drugs, that'll be better during this period. So it is recommended to avoid anti-inflammatory medications for 6 weeks. So other condition we use is lateral epicondylitis. The PRP treatment is a treatment of choice. And there are high quality of evidence shows it's a short-term and long-term efficacy is good after epicondylitis. Long-term follow-up results showed significantly less pain than control group in a research study. Patella tendinopathy, when this PRP is used as multiple injections, it showed best results at long-term follow-up more than 6 months. So the PRP injection can be repeated. So this is one of the examples when we use for long-term, it gives a better results. Achilles tendinopathy, where it is not indicated for conservative management, because conservative management is when there is a Achilles tendon rupture. If the patient is not willing for surgery and when there is a gap in between the tendon, we can't use, there's no place of using PRP. It is not going to help in regenerating tendon completely, but it is recommended after repair of Achilles tendon, if we inject, it promotes healing and well incorporation of ruptured fibers and give better healing and good outcome after PRP injections. Rotator cuff tendinopathy, again, as I told you before, in the shoulder injuries, one of the common injuries, rotator cuff tendinopathy, is done by arthroscopic procedures. After arthroscopic procedures, when we give injection, it helps in good healing. The healing rate is good and pain level and functional outcome is good with less pain. PRP reduces retear, that is after repair, if PRP is given, chance of tear again is less. And for medium size and small size, even without surgery, when PRP is given, the healing takes place in a better way. So that is recommended for partial tear, PRP can be given. Plantar fasciitis, there were 3 articles. It shows, all studies shows greater symptomatic improvement in plantar fasciitis. Improves pain and functional scores compared to steroid injections. So when you compare the steroid injection, it's a better outcome. But in the long term, there's no difference between the PRP or without PRP injection. But it is superior to steroid injections, considering the complications and of multiple corticosteroid injections. PRP is superior than steroid injections in plantar fasciitis. So what's the rehabilitation following PRP in tendinopathies? We have to avoid NSAIDs, avoid smoking, because smoking, it inhibits platelet functions. So therefore, avoiding smoking is better. Weight bearing, it is recommended not to non-weight bearing for 3 days and gradual weight bearing after 4 days. And eccentric exercises after 6 weeks can be started in patients after tendinopathies. Osteoarthritis, as you all know, it's an articular cartilage, is frequently exposed to multiple micro or micro-traumatic events that may lead to loss of tissue homeostasis, resulting in the acceleration of loss of articular cartilage and progression to arthritis. So it is a progressive condition. It starts with age. The cartilage undergo degenerative changes. Because of that, osteoarthritis develop. Inherently, the poor regenerative capacity of the cartilage continues to make the articulate cartilage disease, and it's a challenging problem for orthopedics. So, majority of the patients with osteoarthritis, they are managed non-operatively. So, in these patients, physiotherapy, pain management, and PRP, it has an important role in the management. Only certain group only we select for surgery. So in osteoarthritis, growth factors in these platelets, it increases the synthetic capacity through upregulation of gene expression, proteoglycan production, and deposition of collagen. It helps in maintaining the cartilage function without degenerating further. So PRP, its clinically significant function improved the better scoring system in 1 year. As I said before, it's only useful in mild to moderate osteoarthritis only. Well-established osteoarthritis, when there is bone-to-bone contact, or if the patients are recommended for surgery, some patients, they don't agree for surgery. In those well-established osteoarthritis, PRP is not going to work. It may give mild pain relief for short period, but it is recommended only in the early stage of osteoarthritis. There's a research in Japanese population they have done, and they selected a patient with osteoarthritis of knee, and they injected in weekly interval PRP injection, and they found the symptom disappeared within 48 hours. So this therapy has potential to reduce the pain relief, and this is maintained for up to 6 months. But there are further studies needed. So these are Japanese studies published in 2018. So in use of PRP in osteoarthritis of knee, the early studies indicate that PRP injection may help to treat osteoarthritis, pain and stiffness by modulating the joint environment and reducing the inflammation. but still researches are going on. There is no definite proving, but there are patients' evidence, even researchers promising better outcome in osteoarthritis of knee in early stage. So there are certain questions I have to answer. Does PRP help in ONE? So as I told you before, only in mild to moderate osteoarthritis. Participants who received platelet-rich plasma injections had a significant improvement in their knee pain over 12 months. In another research article, it says. So there is evidence, but still researches are going on. Another question, another myth, can PRP reverse osteoarthritis? The patients come and ask from us whether the PRP will bring the osteoarthritis back to normal. No, it's not going to happen because it's not going to form the new cartilage and bring the arthritis back to normal, but it preserves the cartilage that already you have left behind within the knee. And it improves the quality of life and may enable you to put off further consideration of surgery as an alternative treatment. So you can delay the surgery, or temporarily you can have the pain relief and not to come back to normal. So PRP injections have not been shown to reverse or cure the arthritis. That's my answer. How long the injection lasts when we give for osteoarthritis? There have been studies done to suggest the PRP injections can be effective for 6 to 9 months. Repeated injections can be given in the interval according to the patient's symptoms. So in 6 to 9 months interval, the injections can be repeated. I am telling again, it's only in the mild to moderate arthritis. Or if the patients, sometimes then they may be having many comorbidities and they are not recommended for surgery. So when the risk is high, so there are patients, they request PRP, so they have some pain relief. It is better than giving steroid injections. Another question, does PRP regenerate meniscus? When there is meniscus removed by surgery, or when there is complete tear and it is partially removed, it won't regenerate the meniscus back to normal. But when there is a partial damage or partial injury to the meniscus, if PRP is given, it can stimulate the healing. Or if the meniscal repair is done, after meniscal repair, if you are giving PRP injection, it will facilitate the healing of torn meniscus. So it is recommended after meniscal repair, or when there's a partial tear of the meniscus, that will help for the patient to improve the pain. It is evidence, but it's not going to bring the meniscus back to normal. So another question, how frequency of the PRP to be given? Up to 3 PRP injections within a period of 6 months period, usually performed 2 to 3 weeks apart. So it is usually recommended to give in 2 weeks interval 3 injections as a course, and it can be repeated after 6 to 9 months whenever the patients are needed for pain relief or to postpone the surgery or anything. So it has been used in patients after ACL reconstruction. When there's an ACL complete tear, the PRP is not going to help to regenerate or repair the ACL. But ACL, when it is torn, surgery is indicated in selected patients after surgical intervention. And if PRP is given, there should be osteoligamentous integration, but we are reconstructing the ACL using autologous graft by making tunnel in the tibia and femoral area. So when we give PRP, it helps to incorporate the graft with the bone. So there is osteoligamentous integration takes place in these patients. Maturation of articular portion of the graft. It helps to mature the graft early. And there is evidence that graft harvest site healing and pain reduction is noticed in these patients. There are new studies. It shows decreased donor site pain after ACL reconstruction. We use infraction on union. So in patients with fracture and when there's non-union, this atrophic non-union, when there's no evidence of fracture union. So we use injecting platelet-rich plasma to the site under the X-ray guidance or ultrasound guidance. It helps in promoting fracture healing because it is an inflammatory process. After the fracture, the healing is an inflammatory process. So when we inject platelet-rich plasma, it helps to promote healing. So it is used in management of non-union. What are the risks of platelet PRP? So it is very minimal. When we inject, it may cause bleeding at the site of injection, but usually it is painful for a few days, and after that it will settle gradually. And it can cause infection very rarely, but still we use under a sterile condition. So it is not common. Pain at the site of injection, yes, it is there for the pain. So we can give analgesics, not anti-inflammatory, but we can give analgesics for the patients after injections. And local tissue injuries can happen when it is given without the guidance of ultrasound. So there's a chance in certain areas when we inject, it can cause muscle damage or even nerve injuries have been notified when it's given by inexperienced people. So in summary, PRP has been used as treatment of modality in many conditions in orthopedic practice. It's a less invasive procedure. Reasonable patients' satisfaction have been notified, and research says it has a better outcome, especially even in osteoarthritis. And it is a cost-effective procedure, but there are more research going on and they need some more confirmation to use in these patients with osteoarthritis. Thank you very much. And I am thankful to the organizing committee, especially Mr. Kumara, the physiotherapist who worked with me in Karapitiya, and still he is doing a better service there. He's the one he promoted me to deliver these lectures. Thank you, Kumara, and all participants, and wish you all the best for the successful day, and wish you all the best. Thank you.
Thank you very much, sir. It's very informative. Sir, there are a few questions. Shall I read it, sir?
Yes.
The first question is, if the patient is having blood disorders like sickle cell anemia, would PRP work?
Yes, even with sickle cell anemia, it's a different condition, but PRP, if the platelet count is normal, it can be used, because sickle cell anemia is a different condition, but it is not a platelet related disease. So still it can work.
Thank you, sir. The next question is, what are the conditions when PRP is not performed?
PRP is not performed. The two examples I told you, when there is a tendon rupture, complete rupture, and where there is a surgery is indicated, because tendon, when there is a rupture, we have to bring together and repair it. Without repairing, using a PRP is not going to regenerate or build up the tendon there. And other conditions like well-established conditions like osteoarthritis, where surgery is indicated, it's not going to help. So usually I don't recommend these patients. Even when they come and ask for PRP in well-established osteoarthritis, they need surgery. I don't want to give injections.
Okay, sir. The next question is, sir, what are the contraindications for PRP therapy?
Contraindications, if they have disease related to platelets, for example, if it's a thrombocytopenia, right? So there are conditions related to platelet disease, platelet dysfunction. So those conditions we have to avoid. If the platelet count is not adequate, then we have to get an opinion from the hematologist, and then we have to plan. Only there's a condition, other contraindication is when there is any local wound or any skin reactions. We don't give PRP because it can promote infection. It can bring the infection from the skin to the local site. So that's a contraindication. When there's a local wound or any skin allergic reactions around the area where we are going to inject, it is contraindicated.
The next question is, sir, how effective is PRP for union in post-op fracture, shaft humerus with bone graft?
Yes, it is indicated for in patients with a poor healing tendency. When we, for example, if there's a non-union, we have operated and the patient is applied bone graft at the time of surgery. So in addition, we can give PRP. Even stem cells we inject to promote bone healing in those conditions. Not all patients. Some patients, they have the good tendency to heal, so we don't want to give. But if there are revision fractures, so for example, if they have fractured and there's non-union in the revision surgery with bone graft, so we can give PRP. We give, that's recommended, and sometimes we use stem cells as well.
Okay, sir. The next question is, how we as a physiotherapist learn about procedures and how much it will cost us for injection?
Injections for, it is the kits, the PRP kits are expensive. Even nowadays it is very earlier. I can remember about 6 months ago, it was in certain hospitals, it was about 19,500. Now it has gone double the prices for that. So that's only limiting factor. If they want to go for about 3 injections, it will cost a lot for patients.
The next question is, sir, what is the role of physiotherapist after PRP therapy?
Physiotherapy after PRP, I feel that only range of movement exercises, guided exercises can be started after about a week, not immediately. And muscle strengthening exercises and range of movement exercises are recommended. I am not sure about other procedures like shortwave diathermy and everything. I'm not sure about it. That you will have to give me the answer.
Okay, sir.
Right.
The next question is, sir, does PRP still effective even the patient having seborrheic dermatitis in scalp for the hair growth?
In that part, I have less knowledge about hair growth and PRP, because it has to be answered by a person from cosmetic side. I am not an expert, so I am not able to give a definite answer for that.
Okay. So next question is, if patient have both gout and osteoarthritis, how PRP can help to that patient?
Can you repeat the question? Both?
If the patient have both gout and osteoarthritis, gout.
Gout and osteoarthritis with PRP, yes, there's no contraindication. We can give, because early stage of osteoarthritis, if it is not well established, we can give PRP. That will give pain relief as well as it promotes healing.
The next question is, sir, which stage of osteoarthritis will benefit PRP?
Yes, as I told in my previous, during my talk, it's only early osteoarthritis. Only it will develop, but well-established osteoarthritis is not going to be benefited after PRP injections. Only it may give some pain relief for a short period.
Yeah. So the next question is, sir, is PRP useful for rheumatoid arthritis?
Again, yes, in the early stage, but the thing is they use anti-inflammatory drugs. So these patients with anti-inflammatory drugs, when we are using PRP, it's not going to work well. So usually I don't recommend for those patients, those who are in anti-inflammatory drugs, because it inhibits the function of the platelets and also the growth factors, everything is not going to work well. That's my personal experience, but I am not sure, I am not 100% sure.
Okay. So the next question is, sir, is PRP contributing to cartilage healing?
Cartilage healing, yes, after cartilage repair, early stage, minor degree injuries, it will be helpful. And in certain conditions, when there's a cartilage loss, we replant with chondrocytes, or even we go for microfractures. After that, we give PRP because that will help to regenerate cartilage for some extent.
Okay. Sir, the next question is, sir, will PRP works in arthritis for a long time? But I think you had answered it before.
Yes, I have answered before. It's only for 6 to 9 months only. Yes.
And the next question is, sir, how much percentage of PRP should be given to the patient?
Usually, the PRP kit, depending on the site where we are injecting. If it is knee joint, we can give about 5 ml. For example, if it is epicondylitis, we can give only a 0.5 to 1 ml because it cannot accommodate more PRP. So we have to take a concentrated one and take only about 0.5 to 1 cc for the epicondylitis. Otherwise, it will be very painful. And depending on the site, knee joint, we can give even 10 ml, no matter.
Okay. So the other question is, so is every graft patient need PRP or only for the patient pain indication? Sorry. Every graft patient need PRP or only for the pain indication?
Only indicated patients, not for all patients. That those who have pain and they are not recommended for surgery. Early osteoarthritis, they have pain, and with supportive method like physiotherapy to improve the muscle functions and range of movement, when we give PRP, they have a beneficial effects.
Okay, so the other question is mild or a mild to moderate OA is according to KL classification?
Yes, it is indicated.
Okay, right. So is PRP effective in adhesive? Okay. Is PRP effective in adhesive capsulitis and first and shoulder both?
Yes, adhesive capsulitis, it has an effect for some extent, but outcome is not as promising as for other tendinopathies.
Okay, sir. Those are the questions, sir. Thank you very much, sir. It's very informative. Thank you very much, sir.
Thank you, Dr. Swarnakumar, for the informative lecture. We just enhanced our knowledge of PRP therapy.
Thank you. Thank you again. Have a nice day and good evening for everyone for enjoying these lectures. I hope it has given some information for you.
Okay, thank you so much.
Thank you.